Hey there, and welcome back. So let's dive right into some of the benefits and risks related to massage. Now, you might be thinking, I've had a massage before and it can't be that dangerous, right? And you are correct, it is usually a very safe treatment, but some of this might surprise you. A little disclaimer here, this is not an attack on massage, and some of what I'm saying can apply to many other forms of treatment as well. And I am not a massage therapist, but when I went to graduate school for physical therapy, we learn a lot of overlapping concepts in regards to soft tissue work like effleurage, petrissage, etc. And I utilize techniques and others like them often because they can help tremendously with things like stress reduction, reducing muscle soreness, reducing swelling, and improving localized circulation to inflamed tissue. Not to mention, in the research, there's actually quite a bit of noted placebo effect that patients can get better just from having a trusted provider's hands on them. And I am not one to knock the placebo effect. If it has meaningful net positive outcomes and the patient is informed, then I'm all for it. I don't think that we should knock it. People also often report feeling temporarily a little bit more mobile after a massage, which is more likely due to the muscles having a reduction in something called tone. And I don't mean tone as in like, oh yeah, my arms are so toned because I've been working out. It's a little bit different. It is referring to the essentially like neuromuscular electrical activity of tissue. And if you have questions about that, please feel free to message me. But what I'm saying here is that the feeling like I'm more mobile is usually more due to that reduction in tone than to actually increasing the tissue length. So you've probably gotten a massage and you feel better for a few days, but then the perceived tightness comes back. And that's because our brains are pretty lazy, honestly, and they won't divert resources to maintaining this newfound mobility unless we use it actively, like in exercise. And massage is a primarily passive form of treatment. Also, you might actually feel less pain after a massage, and this is totally valid, totally legitimate, but I want to point out why you likely feel less pain, and that's because massage and a lot of other forms of treatment can release what are called endogenous opioids or endogenous endorphins, so our body's natural painkillers. And that by itself will help to relieve symptoms, but it's not necessarily addressing the cause of them. Second little disclaimer here, as with any industry or field, there's many different schools of thought in the rehab medical provider realm, and I am of the philosophy, again, similar to the placebo effect, that if something is working for a patient and it's not harming them, they're actively consenting, then you do you. Even if there's an intervention that I might not personally recommend or consider to be very evidence-based, I am not going to try and have my patient change what works for them. Now, a massage can be incredibly beneficial and it is quite safe, but as I've said, it's not 100% risk-free. There also appears to be this societal misconception that massage should hurt, physical therapy should hurt. In order for it to be effective, it has to hurt. And while it's true that in some forms of treatment, fully avoiding mild to moderate discomfort can be challenging, but purposefully seeking out significant discomfort and pain has zero therapeutic benefit, absolutely none. And it can be quite harmful. It is true that healthy tissue should be able to tolerate a decent amount of pressure. If I touch a healthy muscle, it shouldn't hurt. But that being said, you can touch damn near anything hard enough with enough pressure and you're gonna cause pain. Pain itself is a whole other phenomenon that for quite some time I've been pondering doing a webinar about because it's far more complicated than what we've traditionally been taught. But let's simplify it for a minute and just think about it as this danger alarm that's outputted from our nervous system. In part one, I mentioned fight, flight, and freeze. And these are activations of parts of our nervous system. So the fight, flight, freeze, the rush of adrenaline or epinephrine is part of the sympathetic nervous system. So that's the part of the nervous system that makes your heart beat really fast when you're speaking in public or you're on a first date. that's the like really activated. And then its opposite is the parasympathetic nervous system, the rest and digest, the one that makes you kind of sleepy after a long meal, or for me after meditation or breath work, I kind of feel like I've woken up from a nap. So they have opposing functions. And during instances that provoke pain, like deep tissue work, especially on people with a history of trauma, this can excite and upregulate that sympathetic nervous system. So essentially, it sounds the danger alarm. And this is why informed consent, open communication, and regular verbal check-ins are really, really critical. So for the reasons I mentioned before, massage done incorrectly does have the potential to damage nerves, to dislodge blood clots, which can then travel to the lungs or to the brain and possibly be fatal. There's some concern that it could contribute to something called rhabdomyolysis, which is where the muscle tissue dies and its protein contents are leaked into the bloodstream. That can possibly fatally overwhelm the kidneys. This is more common with a muscle crush type injury, so think of like a car accident or a heavy object falling and staying on tissue for a long time. But it can happen with extreme exertion or with prolonged, deep, very painful pressure. Furthermore, I already mentioned it can worsen already chronic or persistent injuries. It can cause brainstem injuries because we have something called the vertebral artery in our neck, and those injuries or upper cervical injuries can be fatal. Also, folks with vertigo, dizziness, other vestibular inner ear disorders, those can be made worse by massage as well. So these are all very rare and unlikely, but they can happen, and especially if a provider is not attentive to your pain levels. Massages should never leave you feeling sick, especially not to the point of vomiting. Symptoms like that, along with double vision, slurred speech, difficulty swallowing, fainting, those all signify that you need to go to the ER and seek immediate medical care. So all that to say, providers, please let this serve as a reminder to you that consent is so important, active informed consent at all times, and please consider weighing the risks and benefit of your treatment. Patients, it is not your job to be aware of and know all this stuff. You're not the one that went through all this medical training. I do also think that having some more knowledge about how to advocate for yourself can only help you. You should never feel ever like you have to just suffer through an intervention or that you're being too sensitive if it left you feeling worse. Massage, like many other treatments, has many benefits, but it is not a miracle cure, and it can be a little risky at times. So I really hope this video was useful and informative. I often feel that society teaches us to view medical practitioners as infallible, purely altruistic beings, but we're flawed humans, and your perspective as a patient is just as valid and worthy of consideration when it comes to taking the advice of a medical provider. As always, please feel free to leave comments and let me know what you thought, give me your feedback, and please consider sharing this video if there's someone in your life who you think might benefit. Thanks for watching.